Hey, cat moms and cat dads! Does this sound familiar? You pull out the pet carrier and suddenly your sweet, purring angel transforms into a furry ninja demon, vanishing under the bed. The annual vet visit. A day of betrayal, hissing and questioning all your life choices. You think you're doing the right thing, but are you? Are you accidentally making mistakes that could put your cat's health at risk? Today, we're pulling back the curtain on the annual vet checkup. We're going to expose the essential tests your cat actually needs versus the ones you might be paying for unnecessarily. Get ready to become the most informed pet parent at the clinic. Before we start, let me know in the comments, what's the craziest thing your cat has ever done to avoid the vet? Before we dive into the nitty-gritty of needles and lab reports, let's remember one crucial thing about our furry overlords. Cats are the undisputed masters of hiding illness. In the wild, showing weakness makes you somebody's lunch. That ancient instinct is still hardwired into your domestic mini panther, who's currently napping on a pile of clean laundry. They can be in serious pain or discomfort and still act completely normal, maybe just a little more grumpy than usual. That's why the annual checkup isn't just a suggestion. It's our one chance per year to peek behind their stoic mask and see what's really going on inside that fluffy, mysterious body. Think of it as your annual secret agent mission to decode your cat's health. So, why can't we just skip it? My cat seems fine, we say as they zoom across the living room at 3 a.m. But seems fine is a cat's greatest superpower and our greatest weakness. Many serious feline illnesses like kidney disease or hyperthyroidism creep in silently. By the time you notice obvious symptoms like weight loss or excessive drinking, the disease may already be quite advanced. The annual checkup is all about preventative care. It's about catching these silent stalkers early, when they are much easier and cheaper to manage. It's the difference between your vet saying, "Let's start a new diet," and "We need to discuss serious intervention." It's an investment in more years of cuddles, head boops, and having your favourite mug knocked off the counter. Let's be real. Vet visits are expensive. It's easy to look at the estimate and think, do they really need all this? But think of it this way. The cost of a preventative blood test is a fraction of the cost of emergency surgery or long-term management of a chronic disease that went undetected. It's proactive versus reactive. By establishing a baseline of what's normal for your cat when they are healthy, your vet can spot subtle changes year after year. That tiny little shift in a kidney value might be the first whisper of a problem, long before your cat ever shows a sign of being sick. So while it might sting the wallet in the short term, you're essentially buying peace of mind and potentially saving a lot more money and heartache down the road. It's the ultimate treat yourself moment for your cat's future. All right, the appointment is booked. The cat is somehow in the carrier. What happens first? The physical exam. This is more than just a quick weigh-in and some pets. This is your vet's hands-on investigation. They'll check your cat from nose to tail. They're looking at the eyes for cloudiness, the ears for mites or infection, and the mouth for tartar, gingivitis, or broken teeth, a huge and often overlooked source of pain. They will feel the abdomen, checking the size and shape of organs like the kidneys and bladder. They're feeling for any weird lumps or bumps that shouldn't be there. This physical exam is a critical first step. It gives the vet a ton of information and helps them decide which, if any, further diagnostic tests are needed based on your cat's specific age and condition. The physical exam continues. Your vet will also listen to your cat's heart and lungs with a stethoscope. They're listening for a normal rhythm, any heart murmurs or crackling sounds in the lungs that could indicate fluid or inflammation. They'll assess your cat's skin and coat, which can be a great indicator of their overall health. Is the coat shiny and smooth, or is it dull, flaky, and matted? A poor coat can be a sign of anything from poor nutrition to a thyroid problem. They will also check your cat's temperature. Yes, this is the unpleasant part, but it's a quick and vital sign. A fever is a clear sign that the body is fighting off an infection somewhere. Every part of this exam is a clue in the great mystery of your cat's health. Now let's talk about vaccines. The great debate. It can be confusing. Are we over-vaccinating our pets? The key is to understand the difference between core and non-core vaccines. Core vaccines are the ones recommended for all cats, regardless of their lifestyle. These protect against the most common and dangerous diseases. This includes rabies, which is not only fatal to cats, but also required by law in most places. The other core vaccines are typically combined into one shot called the FVRCP, which protects against feline viral, rhinotracheitis, calicivirus, and panleukopenia. Think of these as the non-negotiable superhero shield for your kitty against some really nasty villains out there. So what are these non-core vaccines? These are the optional extras, the lifestyle vaccines. The most common one is for the feline leukemia virus, or FELV. This is a serious and contagious disease, but it's transmitted primarily through direct contact with an infected cat, like through bite wounds or mutual grooming. So if you have a strictly indoor cat who is your one and only feline ruler, they have a very low risk of exposure, and this vaccine might not be necessary. However, if your cat goes outside, hangs out with other cats, or if you plan on introducing a new cat into your home, the FELV vaccine is highly recommended. It's a conversation to have with your vet to weigh the risks and benefits for your cat's specific situation. A quick word on vaccine schedules. Your kitten will need a series of boosters to build up their initial immunity, but for adult cats, we've moved away from the old vaccinate for everything every single year model. Many modern vaccines, especially for the core FVRCP diseases, are now approved for a 3-year duration after the initial adult booster. This helps reduce the risk of vaccine-related side effects while still keeping your cat protected. Rabies vaccine schedules can vary by local law, so some might be annual and others every 3 years. The key takeaway is to have an open conversation with your vet about a vaccine protocol that is tailored to your cat's age, health, and lifestyle, not just a one-size-fits-all approach. Okay, let's venture into the world of blood work. This is where we get the real inside scoop. The first major test is the CBC, which stands for complete blood count. This is like a detailed head count of all the cells floating around in your cat's bloodstream. It counts the red blood cells, white blood cells, and platelets. As we mentioned, red blood cells are the oxygen delivery guys. A low count, or anemia, means your cat might be lethargic. A high count can mean dehydration. It's the first clue that the body's fundamental transport system might be struggling, and it helps the vet understand your cat's basic energy and stamina on a cellular level. It's the foundation of any good internal investigation. The other half of the CBC focuses on the white blood cells. These are the soldiers of the immune system, the first responders to any invasion. The CBC machine doesn't just count them, it breaks them down into different types, like neutrophils, lymphocytes, and eosinophils. Think of them as different military divisions. A high number of neutrophils, for example, often signals a bacterial infection, like an abscess from a fight or a nasty dental issue. High eosinophils can be a clue for parasites or allergies. If the white blood cell counts are abnormal, it's a giant, flashing neon sign to the vet that says, "Hey, there's a battle going on in here," and tells them what kind of enemy to look for. Finally, the CBC looks at platelets. These are the tiny little construction workers of the blood. Their job is to rush to the site of any injury and form a clot to stop bleeding. If your cat has a low platelet count, they could be at risk for serious bleeding from even a minor injury. This is critically important to know before any planned procedures, like a dental cleaning that might involve extractions. The CBC gives a comprehensive picture of the blood's ability to function, carrying oxygen, fighting infection, and repairing damage. For most healthy adult cats, a CBC every year or 2 is a great idea to establish that crucial baseline we talked about. Now for the other half of the bloodwork dream team, the chemistry panel. also known as a chem panel. While the CBC counts the cells, the chemistry panel checks how well the organs are doing their jobs. It measures various enzymes, proteins, and other substances in the blood that are produced or filtered by the organs. This is where we screen for some of the biggest and baddest diseases in cats. This test is arguably one of the most important preventative tools you have. It's like having a team of internal affairs investigators checking up on every department in your cat's body to make sure everyone is working properly and not embezzling precious resources. Let's talk kidneys. The chem panel looks at a few key values, mainly BUN, blood urea nitrogen, and creatinine. These are waste products that healthy kidneys filter out of the blood. If these numbers start to creep up, it's a major indicator that the kidneys are losing their filtering ability. This is huge because chronic kidney disease is incredibly common in cats, especially as they age. And remember what we said about cats hiding illness. They often won't show any signs of kidney problems until they've already lost about 75% of their kidney function. A simple blood test can catch it much, much earlier, allowing you to make simple changes, like a diet adjustment, that can dramatically extend your cat's life and improve their quality of life. The chemistry panel also gives us a look at the liver by measuring liver enzymes like ALT and ALK-PhoS. The liver is the body's main detoxification plant, and if it's damaged or inflamed, these enzymes will leak out into the bloodstream, causing their levels to rise. The panel also checks blood glucose, which is the primary screening tool for diabetes. It looks at proteins like albumin, which can give clues about nutritional status, and electrolytes like sodium and potassium, which are vital for nerve and muscle function. In one small blood sample, your vet gets a status report from the kidneys, liver, pancreas, and more. It is an incredibly powerful tool for early detection of disease. Don't forget the golden sample. I'm talking about a urinalysis. Yes, getting a urine sample from a cat can be a special kind of challenge, sometimes involving special, non-absorbent litter. But it is so worth it. A urinalysis provides a ton of information that blood work alone can't. The first thing they check is the urine-specific gravity, or its concentration. This is actually one of the earliest and most sensitive indicators of kidney disease. Long before the kidney values in the blood start to rise, the kidneys lose their ability to concentrate urine. A persistently dilute urine sample in a cat that isn't drinking excessively is a major red flag that warrants further investigation. What else can we find in there? A urinalysis also screens for urinary tract infections by looking for white blood cells and bacteria. It can detect tiny amounts of blood, which could be a sign of inflammation, infection, or bladder stones. They'll also check for protein and glucose in the urine. Glucose shouldn't be there, and its presence is another strong indicator of diabetes. And very importantly, they look at the urine under a microscope to search for crystals. Certain types of crystals can clump together to form painful and potentially life-threatening bladder stones, especially in male cats, who can become blocked. A urinalysis is a non-invasive, cost-effective test that completes the kidney health picture and screens for a host of other common feline problems. Let's move to the other end. The fecal exam. I know it's not glamorous, but it's important, especially for cats that go outdoors or live with other pets. Your vet will ask you to bring in a fresh stool sample. Why? They're going on a treasure hunt for unwelcome guests. Intestinal parasites. They'll look for the eggs of common worms like roundworms and hookworms under a microscope. These parasites can cause everything from diarrhea and weight loss to anemia, and some can even be transmitted to humans. It's a simple, inexpensive way to make sure your cat isn't hosting a secret party in their intestines that you weren't invited to. The fecal exam doesn't just look for worms, it can also screen for other microscopic parasites like Giardia and Coccidia, which are single-celled organisms that can cause some pretty nasty gastrointestinal upset. Even if your cat is on a monthly flea and heartworm preventative, which often includes a dewormer, an annual fecal exam is still a good idea. No single dewormer gets every possible parasite, and this test ensures nothing is missed. For indoor-only cats, the risk is lower, but not zero. Parasite eggs can be tracked into the house on our shoes. An annual fecal exam is a simple box to check for total peace of mind. Now, what about our distinguished senior kitties, say age 7 and up? Their checkups should be a little more thorough. At this stage, a few extra tests become really important. The first is a thyroid screen, usually a T4 test. Hyperthyroidism, or an overactive thyroid gland, is extremely common in older cats. It basically puts their metabolism into overdrive, causing symptoms like weight loss despite a ravenous appetite, increased thirst and urination, and sometimes hyperactivity or yowling. It's easily manageable with medication, but left untreated, it puts a huge strain on the heart and other organs. Adding a T4 to the annual blood panel for any senior cat is an absolute must. Another crucial check for senior cats is blood pressure. Yes, just like people, cats can get high blood pressure or hypertension. It's often secondary to other diseases that are common in older cats, like kidney disease or hyperthyroidism. We call it the silent killer because it has few, if any, early symptoms. But chronically high blood pressure can cause devastating damage to sensitive organs, particularly the eyes, leading to sudden blindness, the kidneys, and the brain. Taking a blood pressure reading is a quick, non-invasive process using a special cuff and machine. It should be a standard part of every senior cat wellness exam. It's a simple step that can prevent a catastrophic health crisis. Let's bust a huge myth. My cat's teeth are fine because they're eating. Cats are so tough, they will often continue to eat, even when they are in excruciating dental pain. Dental disease is one of the most common and undertreated conditions in cats. During the physical exam, your vet will look for plaque, tartar, and gingivitis, but much of the disease happens below the gum line. That's why your vet may recommend a dental cleaning under anaesthesia, which allows for a thorough scaling and polishing, as well as dental x-rays. These x-rays are critical because they can reveal painful problems like tooth resorption or abscesses that are invisible to the naked eye. Don't underestimate dental health. It's linked to the health of the entire body. So there you have it, the ultimate guide to your cat's annual checkup, from the physical exam to blood, urine, and beyond. You're now armed with the knowledge to be your cat's best advocate. You know what to ask for and why these tests are so important. It's not about spending money. It's about investing in health and happiness for that furry little creature who runs your entire household. Yes, they may hate the car ride, but they depend on us to make these smart decisions for them. Because at the end of the day, all the chewed-up phone charges and 4 a.m. wake-up calls are worth it for one more purr, one more head bonk. If this video helped you, please give it a thumbs up, subscribe for more cat content, and share it with a fellow cat parent. Now for my final question, what is one thing you learned today that you'll discuss with your vet at your cat's next appointment? Let me know in the comments below.